Hi, welcome back to Med Rounds. I'm Dr. Tim Moser. Today's topic is high blood pressure. Now, healthcare workers are in the habit of calling high blood pressure hypertension. And hypertension is a very serious disease. It can affect up to 1 in 3 Americans and can have the side effects, if left untreated, of heart attack, stroke, kidney damage, dementia, and also peripheral vascular disease, to name just a few. To understand hypertension, we first have to understand what blood pressure is. Now, everybody needs blood pressure in order to survive. With each beat of your heart, blood is forced from your heart into the blood vessels of your body. Now, as the heart squeezes, we have a spike in the blood pressure, and we call this the systolic blood pressure. As the heart relaxes, the blood pressure returns back to its baseline, and this is called the diastolic blood pressure. Normally, blood pressure should be less than 140 on that top number, or the systolic number. And in most individuals, we would like to see the blood pressure less than 90 on that lower number, or the systolic blood pressure. If blood pressure remains greater than 140/90 for a prolonged period of time, meaning several years, damage can occur to the blood vessels. Blood vessels are usually very flexible and elastic. And so as you have the change between the diastolic and the systolic blood pressure, those blood vessels are expanding and contracting slightly. When exposed to very high blood pressures over time, over several years, the blood vessels become less elastic and more rigid. In addition, they start having calcium deposited within the blood vessel walls along with cholesterol. This combination over time can actually narrow the inside of the blood vessels to where they can deliver less blood to the organs of your body. In addition, these diseased or changed blood vessels are more likely to get plugged up altogether, and this can cause a heart attack or a stroke. So why do people get high blood pressure? Well, a lot of it is genetics, just what you've inherited from your parents. A lot of it has to do with diet, with obesity, with lack of exercise, and possibly with excessive alcohol intake. People with kidney damage can also develop high blood pressure because their kidneys are not working properly. Most doctors would agree the hallmark of treating high blood pressure gets back to diet, exercise, and weight loss. For some patients, medications are also required. Dietary considerations would include increasing the amounts of whole grains, fruits, and vegetables in the diet. At the same time, reducing the amount of salt in the diet can have a dramatic effect on blood pressure. Exercise can have a tremendous effect on blood pressure also. Moderate intensity exercise, 30 minutes most days of the week, can have a great effect. Now, an example of moderate intensity exercise would be going for a brisk walk, riding a bike, swimming, or those types of activities. Weight loss plays a big role in blood pressure control also. If a person is overweight and they can lose 10 pounds, they can see a big change in their blood pressure. For those people who drink alcohol, reducing your alcohol intake to no more than 2 alcoholic beverages a day can also have an effect on your blood pressure. Now, in some cases, diet and exercise alone just aren't going to get the job done. You're going to need a medication. If there can be a good thing about being put on medication for your blood pressure, it's that most of the blood pressure medications have been around for a long time. Therefore, they're generic and they're much less expensive than you might think. If medication has been prescribed by your physician, it is very important to take the medication as prescribed. Now, there's always the risk that you'll have side effects with any medication. If this is the case with your blood pressure medicine, let your doctor know. You may be able to adjust the dose or perhaps prescribe a different medication that doesn't have those side effects. Regular follow-up with your doctor or healthcare provider is very important when you have high blood pressure. It's important once the medication is started or once you change your lifestyle to monitor your blood pressure, both in the home and in the medical office, so that we can document that your blood pressure is going down and it's getting back into that normal range. Once you are well controlled with your blood pressure, with medication and dietary changes and lifestyle changes, checking your blood pressure every 6 to 12 months in a doctor's office is probably adequate. This has been Dr. Tim Moser with MedRounds, wishing you the best in health and prosperity until we meet again. Take care.